as a doctor, we are too much pampered by the society, by the family. Like a person, a student, a girl or boy gets admission in an MBBS school, MBBS, he gets started from day zero. Doctor Saab aaye, Doctor Saab aa gaye, right? So there isn't something people as a doctor we feel that because in my managing of the hospital, I deal with many specialists, super specialists, resident doctors and all people sort of things. So the way they behave with an egoistic sort of thing. But in general, I'm speaking because someone will say that you are blaming or typecasting the doctor. But by and large, we are pampered community. That is our biggest weakness.
So I have the honor of introducing to you our next guest, Dr. Pramod Lonikar. He's a radiologist, a renowned radiologist actually, who has taken the plunge of owning his own hospital. Then he took another plunge of getting into business management. He did an executive MBA from ISB, and his goal is to somehow bridge the gap between medicine and business. And his goal is not only to bridge it for himself, it is also to bridge for others. He's very actively involved in teaching business to doctors, radiologists, and that is why I got in touch with him. And during my stint in one of the talks in IRIA, I learned about him, and I thought, why not Dr. Pramod directly? He should help other listeners. In Dr. Pramod, I wanted to tell you, in my podcast, we have a lot of young doctors who follow my podcast. So they are now looking forward to this buzzword entrepreneurship.
Yeah, thank you, Dr. Sumit. First of all, I would like to thank you for inviting me this. And as you correctly said, there are lot many youngsters will be listening to this thing, and that is what my motto is. Because whenever I address to a bunch of people or bunch of doctors, they are in their mid career or fag end of their careers, and they are some sort of fed up with their practice or having some kind of lethargy in their practices. But uh, as you correctly said, that the youngsters will be listening to this podcast, and it is a very much great thing to interact with them or to tell about the entrepreneurship or business of as a doctor. So it's a great thing. Thank you so much. And one thing I want,
You have rightly pointed out that when in middle age we come for asking about business, we are coming from heartbreak. While youngsters are
yeah,
coming with emotion that I want to win it, they have a lot of passion.
yeah, and there is no one to guide them because everything they learn in the medical school is about how to treat patients, how to treat patients, how to treat patients. That's all. And no one talks about tells them about the communication or other things which are very much important. Likewise. So that is the point, and I think they will be definitely benefited with these sort of interactions in the coming years. Yeah.
So, Dr. Pramod, I'll ask you some tough questions to begin with. One is, and
Sure.
I faced this question myself also when I started my business, quarter of century back. A lot of people at that time, and you would resonate, used to say business is a bad thing, and doctors are supposed to do service. What is your take on it?
Basically, the first and foremost thing would be that business is a not bad thing because I'll tell you why. Means if you say it in Hindi that कोई धंधा कर रहा है, so it itself felt it as bad. But as for as we can say that business is not a bad thing because business creates value, businesses create jobs, businesses give taxes, and the same things we also create value. We treat patients, we take money from the patients, we have to manage money, we have to manage the people. So everything there are similarities between business and medicine. So but there is definitely some gap in the mindsets of in ourselves first, and in the society per se also. They are also having a bad feeling about us if we say that I'm doing a business of medicine or sort of thing.
I think, Dr. Mahmood, when I look at the youngsters now, people now with Shark Tank on the TV and so many things happening, now the perception of an entrepreneur is changing. Now, when I talk to people, they look at being an entrepreneur as a different light. It was like 10 years back it was very different. Like they would look at a businessman, he's a businessman like this. Now they know it's like entrepreneurship is creating employment, creating taxes. I think being an entrepreneur, you contribute to the society.
Yeah, definitely. Being an entrepreneur encompasses lot many things. Apart from your professional competencies, whatever the things you are doing, plus you are creating a value. You are giving something back to the society. And I think as a doctor of any specialty, we knowingly or unknowingly in each and every service we give to the patient or to our relatives, whatever the things, like as a doctor we got many calls कि ये patient admit हुआ है इसको क्या करना है, कोई पहचानत वाला है तो बता दे. So we are creating value, we are serving them definitely selflessly. But these things now time has come to put it into a different perspective and accepting that we have to inculcate the entrepreneurial traits in our doctors community. That is that there is a high time now, as you can see the onslaught of the corporates or AI and all other things and society as well.
And Dr. Pramod, one of the questions that I actually wanted to ask you, and which is very important for many doctors, like as young doctors, we feel that doing a MD is the only thing we can do. And you are an example. You, after MBBS, after being a radiologist, after owning a hospital, you decided to do MBA. Why did you decide to do MBA, and
Yeah.
what extra do they teach in this school?
Likewise, in during your last presentation, one of your quote I liked it very much. That if I join any specialty, MD or MS or whatever, you feel as a doctor as an I have arrived. So that feel, I think, it has not creeped me into it. I like that quote of yours very much. I wrote, I will use that in my many of my presentations. I have read that feel. That feel is, I think, it is not a. It's in a way it's okay. It is one of the stop in your professional or personal career or journey. Definitely it is a there is a need to do something extra, like people are not lot many non-medicals or anyone is entering builder or anyone is entering into an hospital industry and they are doing great businesses, like they are scaling up to 1000 crore 5000 crore so and so forth. If you see in last few years there are lot many deals going on in the market, and we doctors as an person, as an community, as an organization of the doctors are not doing nothing much about that thing. We are just we are taking an ostrich like approach, paying attention to the changes whatever they are happening around us in our field. Like in any other industry, if such things are happening, people do will have an such a allah gulla, but they will discuss much more about that thing. They will try to uh, inculcate those skills, but in medical field it is not happening sadly enough. That is the thing which I'm aggressively approaching towards it as an inculcating the entrepreneurial skills as in the doctors. And in my life also, I have started with an humble journey from a middle class family. There was no background of entrepreneurship or like that, but still I could reach here with many of the hurdles, and I can say that there were many setbacks to me also. So that is the thing which I always consider.
Sir, what is the best teacher? I always feel that our setbacks are our best teachers. Any
Yeah,
such you recommend that, or you remember today that, you had a setback, then you learned from it, you came back in a bigger way.
basically, uh, there are many setbacks. Like when in 1995 I started first CT scan in my region. The technology was so much so absolute at those times, and it was the first CT scanner around 200 to 300 kilometers of region. I started that thing, but within 3 4 years, what happened was there was an onslaught of second-hand machines in the market, and lot many machines came into that thing. They created an sort of 1100 rupees or 800 rupees CT scan, and all those things happened. And there was a big setback for me to for an CT scan, being a first generation sort of entrepreneur. Lot many years I have spent in doing that thing. And lastly, that is called as some fallacy. Yesterday I was talking on the biases and how they shape our decision making processes. So that was in some when I was going through my decisions, I thought that that was in some fallacy. Like if you put money into that thing, you keep putting more money into that thing, that business, thinking that things will happen for the good. But it was not, and it was a big setback for me. But as you correctly said in your last lecture, that there you should have an certain alternative source of incomes going on, so that there should be an uh, safety net for you. It was there for me, so I could come out of that thing. And luckily I have invested in the current hospital setups, and they were also friends, so I could smoothly, not smoothly I can say, but roughly I could shift to the hospital side in those days.
I think, sir, I sometimes I like this quote. Some people keep flogging the dead horse. Sometimes you have put your cost onto the horse, and the horse dies, but you still keep flogging it. And
Yeah,
business requires you to adapt to the new normal. So that happens. And
yeah.
the second thing I would say is that sometimes we are the first movers, but the second copies are cheaper. So maybe you were the first mover in CT scan, but other people could do it at cheaper cost with refurbished machines, and that is what you learn when you're doing business firsthand.
Sometimes there are advantages as a first mover, definitely, but sometimes at what juncture of time you enter into the field. It was in those 90s, post 90s, I can say that finances were like 18-20% of 21% of rate of interest was there. Machineries were sort of very early CT scanners. Those were the times. There were clinicians were not opting for the investigation per se. Only CT brain was the idea. Like body scans were not basic investigation required by the clinician. So field was opening, and that was sort of, and it is possible that some of my decisions were wrong at that juncture of time. So it is possible, everything goes in hand. But backhand, if you think that if I could have given a thought in a systematic way, in a structured way of thinking, so I could have taken a better decision. That's what I would like to convey to the younger generation. Informed decisions, or in a structured way decisions one should take, and especially in the non-clinical side. Clinical side, you got a lot many of day to day basis. You discuss cases. If some difficult case come to you, some difficult scan or some difficult ECG which you are not understanding, you can connect with your colleague, your teachers, your senior, juniors, whatever. But in case of non-medical decisions, there is no one to help you, because non-medical don't understand your field much. Because I have seen cases while managing hospital, that a patient came to my casualty. He was breathless. I have to put an endotracheal tube, give him a medicine, stabilize him, give an ambulance, and shift him. And don't take any money from that thing. This is a common scenario for all of us, in at least in tier 2 and tier 3 cities. But if you ask a non-medical, he will say that why you are not taken money. You should have taken 10,000 rupees in advance or 50,000 rupees in advance. So you can understand as a medical,
Yes.
that thing never will come to our mind. So there are different perspectives as a medicals and as a non-medicals. As I always say that empathy is a basic tenet of doctors while doing a business or while treating the patients. So that is the thing.
Dr. Pramod, was your stint during the ISB when you learned as MBA, executive MBA that you pursued? Did that help you to restructure your mindset? And what was that experience? And Do you recommend that any other doctor who wants to go into business, they should do a part, learn the skill of business before they jump onto it?
Uh, First of all, I would like to say think that definitely I have learned lot of many things. I was knowing many things in my life because I have, as you say, that on the job I learned many things. But there should be an validation of the of your thought processes. This is the first and foremost thing. Definitely I could interact with the great brains in the field and across the fields. Like there were many great teachers, like from London School of Economics. Big people are there who are very good teachers. They interacted very well. That is the number one thing. Second thing is that almost all of them were non-medicals. So I thought that as a medico, me teaching and as a non-medical, they teaching the business side of the medicine is a different thing, different perspective. Because I know that some nuances in the medical field as a doctor we know, but they don't know that thing. So that is a big difference between teaching of medicals and non-medicals, a business side of that thing. Definitely, I got a better perspective. My thought process is now clear. Definitely, there are means and ways wherein I apply certain tools and sort of things. I interact with cross industry people, like people from the insurance, health insurance people, or lot many medtech people, or machine making people. So, all across the India, I have definitely interacted, and still I continue with the interaction with all cross industry people. And it is not necessary to do MBA from particular sort of college or institute. Whatever your likings are there, what are your colleagues or your friends are doing it, you can just have that sort of thing. But other way around, I would like also to suggest you are into an such a iconic stage of your journey in these things, and you have benefited thousands of literally thousands of students across your in last 2 decades or 25 years or so. I think you should also take this baton in your hand. You are the right person to hold this baton further in the business side of at least some sort of idea they should get from your side. And you are the right person for that matter.
Really, I think we should do something together. I think something should come out from this podcast. I am very
Yeah.
optimistic about that as well. And
Yeah, definitely. And beauty of you doing it is that youngsters are there with you, young people, because you understand them basically while teaching them medicine. Also, you know their psyche, their capabilities, their enthusiasm, their preferences, their performances, and they follow you. That is the best thing, because some other person doing it will take 5 years to accept the things, like person like me alone doing it will take so much so time. Like I'm doing a redpreneur or radiologist as an entrepreneur series with the Kerala branch of Radiology Association, and there is a less active acceptance. Like डॉक्टर्स से दैट मैं तो कमा लेता हूँ यार 2-5 लाख रुपए पर मंथ, तो इसमें क्या नया आप सिखाने वाले हो. What is that thing? But they are not seeing at a bigger picture sort of thing, a view from the top or bird's eye view. That's what I can say, and which you yourself is able to see that bird's eye view, and I think will be an great idea.
I think perspective is everything. How you look at things. We can sometimes, as doctors, we get little too tied up with the day to day that we are not able to see from above how the process is working. Like you rightly said,
Correct.
how insurance is working, how payments are coming, how machines are coming. We are not looking at them. We are just looking at it from our micro perspective. I think that's very important. So that
Yeah.
leads to the direct question on what are the strengths and weaknesses that doctors have when they go towards business side.
Basically, the biggest weakness, I would like to say that as a doctor, we are too much pampered by the society, by the family. Like a person, a student, a girl or boy gets admission in an MBBS school, MBBS, he gets started from day zero, like Dr. Saab aaye, Dr. Saab aa gaye, right? So there is then something, people as a doctor we feel that, because in my managing of the hospital, I deal with many specialists, super specialists, resident doctors, and all people sort of things. So the way they behave with an egoistic sort of thing, I'm not blaming all of the doctor community. There are great doctors amongst us, but in general, I'm speaking because someone will say that you are blaming or typecasting the doctors. It's not like that. But by and large, we are pampered community. That is our biggest
Entitlement,
big.
entitlement is the correct word. Sometimes we feel we are entitled to win, but we have to fight it
Yeah,
out.
yeah, entitlement, and we got an arrived. I have arrived syndrome earliest because we get easy money. While if in tier two to tier three city, or in any city, if you go with a better good amount of skills in any brand, medicine, surgery, whatever, you earn good as compared to your peers in your class. So that is the strength or weakness. Both the things are there. Our strengths are definitely that we got an we are humble in treating patients, definitely, because we know that something will go wrong at any juncture of time while treating patients. The patient is coming to you and you are doing a CT scan and giving a contrast injection you are injecting, and if he gets an anaphylactic shock, so anything can happen at any time. So you are always humble. That is the biggest thing. And you got a learning sort of lifelong learning sort of skill is there as a doctor, because we learn lot many things on day to day basis, because all patients are not same. So we always think on the patient's line, analyze the thing. So we got a better analytical thing. I think I will say that we are 24 by 7 analytical mindset, where we are into that thing. That is the biggest thing. But flip side is that definitely we are very much poor in mathematics. We are poor in understanding the money. I'm not saying about the finance. Financially you are good, but understanding money and managing the money and using money to earn money, that thing we are poor in that. Definitely wisely investing into that thing. We do investments on the most of the times like on emotional grounds, like emotionally उसने CT scan दिया है 128 slice, so I will take 526 slice, or उसने 1.5 T लिया है तो I will take 3 Tesla slice. These are some examples. Or मेरा hospitals, if I am doing an hospital of 10,000 square feet, I will do a marble sort of things. So all sort of necessary decisions, fanatic decisions, or you don't know what to do about the money. Like people in other businesses, if they earn 1 crore rupees in a year, they will try to definitely do other things for the betterment of the society, or creating some other offshoots of the businesses. We doctors are there with money and we just don't do anything. हमें 2 फॉरेन ट्रिप्स लगा दो, 3 4 बार फॉरेन को, खत्म हो गया हमारा एंजॉयमेंट का आइडिया. That is also good. I'm not saying that that is bad, but but we should come out of that cocoon sort of.
Sir, another of my question that I was wanting to ask you is that, like you said, that we should learn about money, create alternate source of income. How important is that, and how does somebody start thinking in those lines that you can have an alternate income with you, you can make the money work for you?
Basically, these sort of things, I think, with my experience, I'll tell you, my alternative source of incomes definitely gave me an leverage in bad times, in bad weathers. Definitely. So creating money working for you, or passive income we can say, that thing has to come from the day one of your practice, not at the 5 years मैं 5 साल के बाद करूंगा 10. And I'm not saying at all about the investments in the share market or investment. I'm not suggesting any instrument for that matter. I'm poor in that thing. Definitely one has to decide that I will have to have alternative source of income apart from my core practice. One has to decide upon its perspective, is risk taking appetite, availability of the resources, availability of the what are instruments into which he wanted to create that thing. That can be anything like a teaching, simple teaching for MBBS students by an physician, or taking tuitions can also be a good alternative sort of thing, or doing some extra hours of duty with an ICU, whatever the things. I'm just suggesting that thing. Any instrument will do definitely, but that should create, it will accumulate the value over a period of time in 2 years, 3 years, 5 years, and you will also get mastery into that thing. So that perspective has to be developed right from the beginning. That is must.
So also, I would say that we should always be putting money into our strengths. That is something that I do. Like suppose I don't understand something, and sometimes you read on the social media, it becomes so in like forcing that everybody is now putting money on share market, and as a doctor, you don't have time and you don't know,
Yeah,
but you will not put money under peer pressure and you will lose money. You have to make sure that you're putting your money, hard earned money. As a doctor, we earn money with lot of
you
hard.
are very much hard on me. Yes,
You
sir.
have to be careful with the, being swept away by emotions that everybody is putting money into this kind of colony. I will also go. You will lose money. You have to put money where you feel strongly about, and you are in control of that situation. That is what my 2 cents are about.
I would like to add one thing. We doctors think that patient think that we are gods most of the times. Okay, so we always think that we are the boss in every aspect of our life, and people also ask you about many things in life. So, "वाह, बच्चे की शादी नहीं हो रही, बच्चे को बच्चा नहीं हो रहा." Anything they will ask you, and you are obliged to give advices to them. But for your decisions of any sort of financial, especially financial decision, investment decisions, oftentimes you tend not to bring in consultants or specialized persons. Like if I am having a cardiac element or a diabetes, I go to a diabetologist or a cardiologist. So as a doctor, we always should sit with our CAs or any other industrialist friends. Like, what is their perspective about the investments and all those things? So that thing has to be inculcated definitely. Taking an advice from an expert, whatever the things you are doing, that also should be propagated in a definite way.
I totally agree that as doctors sometimes we feel कि सब कुछ कर लेंगे, हमें ना सीए चाहिए, ना लॉयर चाहिए, ना हमें ट्रैवल एजेंट चाहिए, हम तो सब खुद कर लेंगे, बट हो नहीं पाता है।
Correct.
We have that God delusion कि मैं तो सब कर लूंगा, and taking help, but always knowing that that other person should not have a vested interest to fool us, but taking help always helps.
Definitely, vested interests are definitely there. As a doctor, we are more prone to get duped by others because people feel that if आप सब्जी लेने भी जाओ तो बोलते हैं डॉक्टर साहब आए या फल भी आपको 25 रुपए ज्यादा दे.
आजकल पैसे नहीं है, टाइम कम है, मतलब वी आर दी कैंडिडेट टू बी ड्यूब ना कि पीपल विद मोर मनी बट लेस टाइम, वो
Correct.
गलती कर जाएंगे।
So that thing definitely happened. But taking advice from an regular advice, sitting with an CA or sitting with a good
Helps.
friend, yearly at least one एक मीटिंग तो बनती है definitely, which I have not done. That's why I'm telling. In recently, recent in early phase of my life, I did not do that. Done that thing, I would have been a much better position definitely. But later stage of life, I started taking advice from the non-medical friends or financial consultants or any sort of consultant. Give me a fees, handsome fees offer to that person who or she, whatever, who or she will it, and they are ready to help you out definitely.
And sir, I always feel that as a society, we go overboard on one direction. There was a time when doing a business was looked down upon, and now there is a time where we are celebrating entrepreneurs so much that anybody in job is getting FOMO. Am I missing out on something? Even if he never wanted to do some business, but he's feeling FOMO. Do you think doing a job is bad to pursue if someone is happy with it, or do you? I hope you get my question. एक तरफ है
Yeah,
कि
definitely.
आप कह रहे बिजनेस ही ठीक है, तो जो जॉब कर रहे हैं वो बेचारे को फोमो हो रहा है, क्या सही है क्या गलत है?
These are the times of algorithm times. Yesterday I was listening and podcast on some of the Mojo story. of Barkadat, and she invited some youngster, very young, and he has written some book. And that guy said that, sir, ma'am, our generation is driven by the algorithms, and we are inspired by the real stars. There are no role stars for us. There are real stars for us. So,
Most of the
that
real stars, sir, are like this. One make business like this. They are making some
correct.
30 reel, but most
Apart from the laughable sort of things, the thing is that nothing wrong. There is nothing wrong in doing a job. Definitely, you should recognize your capacities, your perspectives, why you have into job, at what cost you are doing a job. You wanted to stay with your parents, so you are doing a job. There are no chances of establishing your practice of any sort of thing, so you are doing a job. You want early money, definitely a fixed income. Your mindset is like that, you need certain x amount of money fixed in a month. It is not possible to get from day one, definitely in an business or your own practice, if you say. So it is your perspective. So there are certain things you have done in lieu of other things. So you jot down your things, whatever the लिख लीजिए कि मैंने ये जॉब क्यों कर रहा हूँ, why I'm doing job. These are the things I wanted my perspective is this thing, my risk taking appetite is this thing, my family background is sort of things. I don't have money from my father which inherited like X amount. So I don't have money initially. I don't have courage to do that thing. Like doing a business, like you have to spend money. Sometimes it happens that things will not go definitely as you think in a correct direction. So, but doing job is not a bad thing. But other way around, what value you are creating, you should note down that I am creating these values. These are the things which I am writing down. Like in other fields, what they do is they write their CVs and they write their deliverables. What are the things they are delivering? Like from X amount of business, they have created X plus 10 amount of business in a period of 1 year. So you also should know while doing job, so that you can negotiate in a better way with that your employer for next time when you are asking for a salary hike. So these are the things, nothing bad in doing a job, definitely.
Actually, what I feel is that job is one of the best place to learn business. Actually, people are underestimating doing a job, and because it's not very fashionable to say I am, but on job you can learn a lot of things if you change your mindset to think like an entrepreneur. Even if you do not have skin in the game, you think like problem solvers. You solve problem for your employer. They will appreciate you. You will grow even without starting your own business. You will grow because you are thinking like an entrepreneur. You're creating value, you are creating growth for the company. But most people think that job is a burden. If you think of it as a burden, then it is tough. You think of it as an
Correct.
opportunity to learn. It is actually, we all have learned, I'm sure you would agree, we all have learned many parts of our journey have been by working for others.
Definitely, that's what trade-offs you are doing. Definitely, one should have that thing of FOMO and all those things. Definitely are creeping in because of all these real stars, as I earlier said. But on job also, there is a lot of learning. Try to emulate your employer. Try to fit in this chair. What are the things and why he is doing? He may be doing it wrong, definitely, but try to understand. Try to analyze the things and that perspective.
बहुत हमेशा गलत ही लगता है सर. You have to see from his perspective why it is, why he is
Correct.
doing, what are his risks. The person who has skin in the game would make a the decision based on some other factors which a person who doesn't have skin in the game will
Correctly.
think other way.
Yes, his upbringing, his perspectives are definitely different while
When you
taking.
learn that, you start thinking like an entrepreneur. Then one day you may take your plunge as an entrepreneur, but you have to learn the art.
Definitely. But other thing is that entrepreneurs means while doing job also, you also can be an entrepreneur. Your entrepreneurial skills in small things also can apply, like innovations in your reporting, innovating treating patients, innovating in any in particular sort of things. Try to innovate yourself while doing job also. That will also give you a joy, that may create an alternative source of, definitely alternative source of joy and income also. That, and in case of your job is not secure, you can shift to that alternative source of income. So try to create other innovations in your particular field. I'm not saying particularly about radiology. In any stream of medicine, you can do that thing.
You like, even if you're on a job, but if you're constantly improving, seeking to do, okay, now we will do it like this, we'll put an image on the report or something, it will give you satisfaction. You That
Yes,
is very,
definitely,
and it will make you
definitely.
happy. Not, then otherwise it becomes boring. You have to constantly innovate, constantly think of bringing more value to the system that you're working in.
Like other day, I was seeing हम गांधी जी के तीन बंदर देख, बुरा मत देखो, बुरा मत सोचो, बुरा मत सुनो. वे चौथा बंदर ये जो आया है, he's
हाँ.
looking towards his mobile. My point is that we don't interact with the society, we don't interact with the people. That is my point, and that is the biggest. If you try to learn, see people, talk to the people. Last week I was in Mumbai and in Konkan region, in a small town. Was there, and I stayed at such a hotel that there was an machi market or fish market. I'd gone there for couple two times. I gone there. I said that why we are going there. I said that this there I will learn something, definitely new sort of thing. Organized chaos they are having. Machhi bazar jo आवाज जो रहते, they are making so much of so rices. All females are working. और क्या चल रहा है कुछ भी नहीं समझता. But everyone is doing their business.
So it
So
is chaotic, but there is some order which is guiding them
correct.
all.
Organized buses are going on small rasta. Every now and then there is a traffic jam. So everyone is running, everyone is doing something, but there is an organized chaos, and still people are doing business and all those things. But with, as I earlier said, that चौथा बंदर जो महात्मा जी का, गांधी जी का है, वो हम हमारे मोबाइल की तरफ ही देख रहे हैं. We're not reading people. So if you start
Yes.
reading people, you talking to strangers, talking to your patients, definitely that will create a value. That thing also been should be inculcated in your mindset, that talking to the people.
So my learning as an entrepreneur has always been that it ultimately boils down to people. You have to
Yeah.
understand people who work for you, your partners, people, and not only that, you have to understand your family also. You might be running
Yes.
to create business. The family is not appreciating. They are saying you're not spending time with me. So you have to understand family expectation, your expectations, and then you have to understand what you are, what do you want out of life. Otherwise, it becomes very
Yeah.
tough. So you have to
First
understand
and
people.
foremost, first and foremost thing will be understanding yourself, what you want. Sit with yourself. I always say that sit with yourself. Don't sit with your colleagues. Sit with yourself, and then you can start understanding your wife, your children, your parents, everyone, and your patients also. Because as a doctor you cannot sit alone and do the practice and earn money. You have to, people will storm into your room, they will interact you, they will compel you to talk. हमेशा पूछेंगे कि डॉक्टर साहब हमारा पेशेंट ठीक होगा या नहीं होगा. So things are like that. Yeah.
Things will go wrong also. I think this is one of the messages that I wanted to give through this medium today. Things will go wrong also. Sometimes we feel that we will always win. We see like successful entrepreneurs, you will see, okay, uska IPO आ गया, ये हो गया. But there are people who will get it wrong also. तो हारेंगे भी, तो वो सोच के चलना पड़ेगा. And we'll have to take your family together. बात करनी पड़ेगी सबसे. ऐसा नहीं हो सकता कि आपने मिशन बना लिया कि मैं मार्स में जाऊंगा, मार्स में जाऊंगा, आपके बच्चे का वो मिशन हो सकता है ना हो. तो you have to understand people is, in a nutshell, is very important.
While doing any entrepreneur journey, the first and foremost thing is to prepare yourself for failures.
Yes.
Definitely failure. That would, I would like to say that if you get success in your first sort of attempt, definitely you are lucky enough, or you are in a correct direction. That is great thing, big thing, very good thing. But prepare yourself for the worst, definitely, and keep invested, keep connected, keep trying. And what is your goal? Because while going from A to B, you will definitely get lot many bad things, lot many bad experiences, lot many losses. Definitely I will go that thing that way, but keep the goal in your mind. Definitely that will help in your entrepreneurial journey.
Sir, any final message from your side to the audience?
Definitely I would like to say that catch them young, for the starting of catch them, or otherwise I would like to say that catch the doctors young for their entrepreneurial journey. Any sort of that is not a big thing. Doing a business or doing an entrepreneurship, you should not be great like 1000 crore or 5000 crore or anything, but that thing has to be inculcated, that's all. And if earlier is the best in their start of the career, that will be the my final message during this podcast.
And I'll add a line here by what Sir has told is absolutely right. When you're young, you have the energy and you believe in possibilities. जब हम young होते हैं हर तरह की possibility लगती है ये भी हो जाए चांद पे भी चले जब मिडिल एज में जाके व्यापार तो बहुत सारे क्वेश्चन मार्क्स आ जाते हैं जिंदगी में वो जीतने नहीं देते वो एस्केप वेलोसिटी चाहिए बिजनेस को ना आपको ग्रेविटी से हटना है तो दैट हेल्प्स इफ यू स्टार्ट यंग एंड दैट इज द बिग मैसेज बाय डॉक्टर प्रमोद थैंक यू सर फॉर जॉइनिंग इन and
And
guide. It has been so wonderful to talk to you actually.
yeah, thank you so much, boss. Thank you for this great opportunity. Definitely, we will be in touch in further endeavors. Thank you so much, boss. Thank you. Thank you. Thank you. Bye.